The Indiana Family and Social Services Administration has temporarily suspended work requirements for people in the Healthy Indiana Plan in response to a federal lawsuit filed just last month. The FSSA says it will wait and see what happens with this suit and similar challenges in other states. Now, in an email statement, Indiana Medicaid Director Allison Taylor said HIP members are reporting successful engagements in their workplaces, schools, and communities. An estimated 70,000 Hoosiers were expected to comply with the requirements. More than 400,000 people have health coverage through HIP. Now with us now is Eva Bell, a community organizer with the Grassroots Community Advocates Hoosier Action. Eva, thank you so much for being here.
Thank you for having me.
Now from what I understand, you are one of the Hoosiers participating in the Healthy Indiana Plan. How has this affected you?
So I was actually really relieved when I heard about the suspension. When I first heard about it, it caused me a lot of stress. I have 3 kids, and at the time I was working 2 jobs when it came into effect of July. And between those 2 jobs, my hours would not have met the requirements, and I could have lost my health care. And if I lost my health care and got really sick and couldn't go to the doctor, then I lose my job. And something that was initially a safety net program would have turned into a poverty trap for me and my kids.
So can you explain a little bit about those restrictions that went into effect earlier this year? So
the Gateway to Work program are these paperwork requirements that the state had put on Medicaid. And what it would mean that starting in July, people would have to report at least 20 hours of work. And by next year of 2020, it would have to be up to 80 hours. And if you could not meet those requirements through work, school, or volunteer hours, for about 8 months out of the year, you would lose your health coverage.
So now what would you like to see happen as this moves on through the courts and so forth? And there are these challenges too in other states. What would you like to see happen?
I would just like them to be gotten rid of. They're not necessary. There's already a broken infrastructure with processing paperwork. We don't need any more burdens on those who just want to have health care.
Now you have a personal story. What would have happened to you if this didn't happen?
So if I didn't have health care, actually 2 months ago, I had a sudden case of appendicitis. And the only thing that got me to the ER that made me have to find childcare for my kids so I can get a ride to the ER was the fact that I knew I had insurance. Otherwise, I would have stayed and tried to ride out the pain, and my appendix would have burst. And that could have been really detrimental to me and my children.
We just have a few seconds left. You're part of this Hoosier Action. What's the message Hoosier Action is trying to get at?
So Hoosier Action is a grassroots organization, and we're trying to build a better Indiana. And we want to improve Medicaid and access to Medicaid and remove barriers for people who are just trying to live their life and do what they can and just be able to go to a doctor when they're sick.
Eva, thank you so much for being here today. Appreciate it.
All right, thank you for having me.